doing.
Thank you. Thank you, Heather. Thank you for inviting me. And thank you, ladies, for listening. And I know Heather told me a little bit about your group and the marvellous things that she's doing. And I know there'll be a very varying age range. There'll be ladies out there who have perhaps been through the menopause, ladies who are going through it, and ladies who will go through it one day. And as sure as eggs are eggs, we will all go through it if we are women. So my job is really to educate you and do a little bit of talking tonight around what I do. So I'm Teresa Davison. I'm a nurse practitioner, historically from primary healthcare background, so that's GP land. And I've always specialised in women's health. And then for the last probably 12 years, I've specialised in menopause health. There aren't a lot of menopause specialists, and there's not a lot of time for it in the NHS, as some of you will know. It sort of hits the bottom of the pile. Even before COVID, we were at the bottom of the pile, and now it's not going to get any better for the foreseeable future. I do a little bit of NHS work, but a year ago, last May, I decided to set up Somerset Menopause Clinic in Taunton, because I realised there was a gap in the market for women who want time. And it's not just women who can't get an appointment with their doctor. It's for women who already see their doctor about HRT, who are already on HRT or want to explore other options. But what I can offer them that the doctor can't is time. So my clinic is set up to offer a 45-minute appointment. I would see a lady for an initial appointment, and then I would see her 3 months later if I prescribe for her, to see how things are ticking along. And then at that point, I would refer her back to her GP. So of course, because it's private, there's an expense, but it doesn't have to be an expense forever. It can be a sort of one-off consultation and then a one-off review and then hop back to your GP. So, you know, I understand the cost implication. There are ladies who like to see me ongoing because it's easier for them and it's affordable for them, but it's not affordable for all of us. So I take that on board. So I'm a British Menopause Society registered specialist. There are about 180 of us in the country, gynecologists, doctors and nurses. As you can imagine, there aren't very many in Somerset. So that obviously plays to my advantage. And, you know, I've done general nursing in the past and I continue to do so, but this is my speciality. So my mission really, whether it be to talk to groups of ladies like yourselves, whether it's going into GP surgeries, which obviously I'm not at the moment, but I used to do GP education, or whether it's seeing women on a one-to-one basis, is to help to explain what women are going through. And I think we put up with a lot of symptoms and circumstances that we write off as sort of lifestyle things and things that we just have to get on with without knowing what we can do to help ourselves. It is not my mission to get everybody to take HRT, but it is my mission to get everybody to understand it and not be scared of it. So that's the beginning, okay? Very quickly, just to clarify, for those of you out there who are thinking, when does it all start? What happens? The definition of menopause is literally the last menstrual period. So the way we talk about it out in the general public is feeling menopausal, being menopausal, going through the change, all those sorts of things. As clinicians, we talk about the premenopausal woman being from the day the young girl starts her periods right through to 12 months after the last menstrual period, when you can categorically say that you are postmenopausal. So it's a difficult diagnosis because it's retrospective, and those of you who've been through it or are going through it will know that you don't just carry on having a monthly period that then suddenly stops and you know that's the end. Sometimes you go every 3 weeks, then for 4 months, then for 2 weeks, and it's all very erratic. And the other thing you'll know is that a lot of women are on modern contraception that stops you having periods, and there you are at age 47, 48, 49. Are you still supposed to be having periods? Are they being masked by your contraception? So it's not always terribly straightforward. But postmenopause, which is 12 months after the last menstrual period, averagely occurs in the UK at age 51. Now, the average for perimenopause is 45 to 55, and this is where things are changing. And what's happening is that the ovaries are not functioning as well as they used to. When we're young and having regular periods, we're having lovely estrogen that cycles like this. You know, we have good times of the month, bad times of the month, on it goes. When we get to the perimenopause, our estrogen levels deplete and they don't go smoothly, nicely down so that you don't know so that you hardly notice. It's more of a sort of jagged effect like this, so that you'll get symptoms that come and go, stop and start, times when they're really bad, times when they seem to have gone away, and then they come crashing back again. And when we start to lose estrogen, there's a whole myriad of symptoms that I don't want those of you who aren't there yet to be sitting out there biting your nails thinking, oh my gosh, well, this is going to happen. All women will go through a menopause. An average duration of the menopause is 4 to 7 years. There's no blood test or crystal ball or scan or x-ray that will tell you how long it's going to be for you. You don't know until you're in it, until you come out the other side. 88% of women will get symptoms. 25% of that 88% will have symptoms that debilitate them enough to come and talk to somebody about it and to perhaps contemplate treatment. Lots of women will get the odd hot flush, the odd night sweat, feel a bit irritable, feel a bit grumpy, feel a bit hormonal, but they'll manage and they'll get through it. So as your estrogen depletes, am I talking too fast, Heather, or is this all right?
No, go for it. Yeah, that's great. No,
as
really
your
good.
estrogen depletes, you will notice that you may get hot sweats and hot flushes and night sweats. Those are the most definitive symptoms in menopause. They're not the only ones. They're not the most serious. They're not the only ones deserving of treatment, but they are the ones where women think, yes, this is what's happening. Whereas when I talk about the others, you'll realize, oh gosh, that could be down to all sorts of other things. So you've got chemical transmitters in your brain called noradrenaline and serotonin, which are dependent on a level of estrogen in order for them to work and give you a consistent thermoregulation. In other words, keep your temperature constant. When your estrogen depletes, they go a little bit all over the place and you get hot and cold at different times. You could have a bright red hot face and neck, freezing cold hands, think what on earth is happening? But the definitive symptoms are these flushes that come during the day and these sweats at night that vary between throwing the duvet off and feeling a bit hot and getting up at night and changing sheets or nighties that are soaking wet. That's very, very variable. Then the other things that can happen with the lack of estrogen are anxiety, brain fog, losing your memory. We lose something called the practice effect, which is refers to something that you've done all your lives, with your hands in your pockets, with your eyes closed. You've done it so many times, you now all of a sudden can't remember the directions to get to your friend's house. You can't remember where you keep something. You can't remember someone's name and you've already asked them twice this morning and you can't bear to ask them again. And this is called the practice effect. And during the perimenopause, where your hormones are all over the place, you lose this. When you come out the other side and you are truly postmenopausal, you'll still have some estrogen circulating, but it'll plateau and vary only very slightly. And there is scientific evidence to say that you'll get the practice effect back. And I think that I could vouch for that. So I think that when I was perimenopausal, had I had to do this talk, I would have had Post-its stuck all over the computer, all over the walls, and some behind me. And now I haven't. So I think that some things do get better when the levels are smoother. So added to that, you can get irritability, anxiety, tearfulness, can't sleep very well, tired all the time. Your metabolic rate slows down, so we get this increase in weight, particularly around the middle. You can put on just a kilo or two and already feel like you're really fat because your jeans have got to go up a size and things like this. These are all normal findings with estrogen depletion and will vary from woman to woman. Now, the way we treat these symptoms, if they need treating, there are all sorts of things you can do. The biggest thing you can do is lifestyle. And, as nurses, we bang on about this again and again, don't we? That, try and stop smoking, don't drink too much alcohol, cut down on caffeine, get out there and exercise, take up something new, kind of reinvent yourself. It perhaps coincides with a time of life that is so difficult. We can be between elderly relatives who need looking after, children who are adolescent and growing up and perhaps leaving home, the empty nest syndrome. It marks the end of fertility, which for some women is, they know it's there, but it's a really difficult time. It's a time of very, very mixed emotions. So try and instead of thinking it's all downhill from here, try and think, what can I do from now? Think about something different, reinvent yourself, and perhaps hopefully you're at a time of life where you can spend a little bit more time or money on yourself and be a little bit different. So when ladies come to my clinic, they generally have tried most of the over-the-counter methods and they want to talk about hormone replacement therapy. But I'll just do a little bit about over-the-counter therapies. There are many of them. You can go to a health food shop and buy all sorts of things like black cohosh, red clover, sage, there's magnet therapy, there are creams, there are lotions and potions. I do not discount them, but what I say to ladies is they do not have any scientific evidence to say that they're going to help. And the reason they don't come with horrible warnings like medicines and particularly HRT do is that they haven't had big studies done on them, which tell you not only the good things that are going to happen if you take it, but also actually the awful things that might happen. So just be very aware of that, and be aware that in black cohosh and red clover, there is some estrogen, probably not enough to increase your risk of breast cancer, but therefore probably not enough to make you feel any better. But some women do, and I would never, ever discount it. I would say that is for you to explore and for you to have a look at. And there is also something called the placebo effect that can be up to 60% successful, where when we've invested our time and our energy and particularly our money in something, we are going to skip away and already that is going to start working because we've done something about it. So when ladies come to me, they've usually tried a lot of those things and they're sitting there and they're a bit desperate, and they've been to their general practitioner and they happen to mention that their grandmother had breast cancer, and the shutters went down and the GP said, no way are you going to have HRT. So let me tell you a little bit about HRT so that you're not scared of it anymore. It's not for everyone, but the NICE guidelines say that hormone replacement therapy is the best possible treatment for women who have symptoms between the age of 45 and 55, any or all of those symptoms that I have just talked about. It is the best possible way forward, provided the clinician has done a proper risk-benefit analysis. So one of the first things I'm going to ask you is, have you got a family history of breast cancer? And if you had 2 first-degree relatives with breast cancer before they had their menopause, so young ladies having breast cancer, you may not be a good candidate for HRT. We would want to look further into genetic screening and make sure that we wouldn't put you at risk, because giving you estrogen could promote that and bring that forward. So that's not a straightforward thing. But if you have one relative who's had breast cancer, particularly if it's a secondary degree relative like a cousin or a grandma, it does not increase your risk of breast cancer. One thing to take away from my little talk is to look at the British Menopause Society and look at the information on there. You'll find some charts which will explain risks to you and make it very clear. And just, if I very briefly tell you that in women who are aged 50 to 59, out of 1,000 women in the UK every year, there will be 23 cases of breast cancer. So that is, for all of us, our population risk. We're going to increase that if we smoke, if we're overweight, and if we don't exercise, and if we drink too much alcohol. We're also going to increase it slightly if we take hormone replacement therapy, but actually not as much as if we drink 2 units of alcohol at night. So if you put a lady on HRT, there'll be 4 extra cases per 1,000 per year. If you drink 2 units of alcohol, it will be 5. If you smoke, it will be 3. If your BMI is over 30, it will be 23. And if you take exercise, it will reduce by 7. Amazing. So we're living in this legacy of studies that were done in 2001 and 2002, where we went overnight from women wanting HRT put in the tap water to prescribers and women being terrified of it. And it stopped. And my generation of women were deprived of it when actually most of them would have been absolutely fine. And we've got to re-educate people now that actually, yes, we're never going to say to you, like in my parents' day, take this, it will make you feel better. But they never got one of those leaflets inside the packet that said it might make you feel better, but it's also going to do this to you. We're going to say to you, this will slightly increase your risk of breast cancer by a very, very small amount. I mean, I don't know about you, but I wouldn't refuse a glass of wine, a second glass of wine, because of my risk of breast cancer. I'd refuse it because I had a headache or I was going to work the next day, but it would not enter my head. So the press have put that across to us, and that's all we remember. And when the press put out those bulletins that said, don't take HRT, it can increase your risk of breast cancer, they were right. But they didn't put underneath that, but if you do take it, it will improve your heart health and it will improve your bone density. So more women in the UK in their 50s die every year from heart disease than from breast cancer, and estrogen protects the heart. And we all can have a potential problem with bone density. Our bone density peaks by 25, plateaus till we're 45, as long as we're well people not taking high doses of steroids, and then it declines slowly after 45. That's normal. It does the same for men, but they peak higher and they lose it slower, and they don't generally live as long. So by the time we're really ancient ladies, which we hope to be, we'll be quite fragile and we could all have fractured hips. But by that stage, it would be really silly to put everyone on HRT so they don't get a fractured hip, because you would seriously increase their risk of breast cancer. So can you see how this is bespoke, and it's very individual for very individual ladies? And that's why it can't happen in 10 minutes. Even if you're lucky enough to get that appointment, even if you're lucky enough that you've got a GP who's really knowledgeable about menopause and HRT, and there are loads of them out there, I'm no different to any of them, they can't give you the time that I can give you in your clinic, in my clinic. And I do get several ladies who come in who say, I'm on HRT, I love my GP, I really trust him or her, the HRT is suiting me, it's doing all the things, but in my 10-minute review, I can't ask about the risk of stroke, the risk of breast cancer, what I read in the paper last week that has really frightened me. So it's all about education. And I also think if you're going to go to your GP on the back of this about HRT or about options, don't expect to be, and don't be disappointed if you're not given a prescription there and then. In a 10-minute appointment, I'd rather see that lady, give her some websites to look at, and say to her, come back and see me next Wednesday at 10 o'clock, and then we'll talk about it when you've done your own risk assessment as well. So look at the British Menopause Society. Look at a website for Menopause Matters. That's a brilliant website. They issue a quarterly magazine, which used to be subscription only, and as of 1 year ago, it's on sale in Smiths, which is an absolutely wonderful move forward. That, you know, we can go into shops and buy magazines about anything and everything, but for some reason, menopause has been hidden. The generation of women coming up behind me, Heather, and your generation of women, you're at least 2 generations behind me, you can change this. When I think of the hormonal journeys in our lives, we all start our periods, some women have pregnancies, and all women will have a menopause. Those first 2 are celebrated, they're empathized with, sympathized with. We do all sorts of things to help people through them. And this last one is embarrassing, shoved under the carpet. Women try to hide it, they're scared of it, and it affects their confidence. And I think it's really important that we get it out there in the workplace, that people talk about it and don't have to feel like this. And we've got World Menopause Day.
Oh, sorry, I just interrupt. I just had someone put a message on. I'm not on HRT anymore, still having a few hot flushes. What can I take to maintain my bone density? Can I just say one quick thing? Doing the resistance exercises that we're doing is absolutely key. So that you're already winning.
You're already winning. And exercise is the most important thing, and not drinking more than 14 units of alcohol a week, and not smoking. There is an argument for taking vitamin D with a calcium supplement. I've actually just attended a conference last week where the specialist there said it doesn't show a lot of difference in women other than very elderly women who are bedridden in care homes, who get a little bit of help from it, in people who can help themselves with diet and exercise, and of course sunshine. If you can get sunshine, that's great. We're not going to get much now, but we have had quite a lot this year.
Yeah.
So don't be frightened about that. And HRT is not first line treatment for bone density. So women who've got inherent bone density problems are not going to be put on HRT. It's a bonus if they're on it and they've got those inherent problems. So you're doing absolutely the right thing. Diet and exercise is absolutely brilliant. So that was a really good question. Really good question.
Definitely. I don't know if there's anything else. Oh, and the lady was saying the menopause, can't see who it is. The Menopause Matters is fantastic.
It really is. I'm so glad she's looking at it. It's got lots of advertising in it. Not bad advertising, good advertising. No. I spoke to a lady this morning who runs a company. Am I allowed to mention another company?
Yeah, you carry on.
I spoke to a lovely young lady this morning who runs a company called Hot Tea Mama. And it's been about teas for ladies to drink when they're pregnant, you know, the herbal things and the things that are supposed to be good for the cervix and all the rest of it. And she's now expanding into a new brand called Take a Pause. Now, I'm not recommending it because I don't know anything about it. She's just talked to me about it. She's going to send me some samples. But I did say to her, contact Menopause Matters and get an advert put in there, because I think ladies are trying to look for things. Not everyone wants to take HRT. And even if you've got no history of breast cancer, for some ladies, knowing that it's going to increase their risk slightly is going to keep them awake at night. What's the point in taking something that makes you feel, okay, the hot flushes and the night sweats have gone away and maybe your anxiety's gone away, but I'm awake all night worrying about the breast cancer. It's not going to help anyone. It's not right for everybody. But I want women to know that it's not as scary as people thought it was.
I think,
It's
It's
really
sorry.
important, really important. And the other thing that ladies are very scared of, or we're all very scared of, is blood clot. By the time we're 40, we've already doubled our risk of blood clot, and we can help that doing all the things that you're doing, Heather. So keeping our weight down, exercising, not smoking, all that sort of thing. If you go onto HRT, we had a headline probably only about 9 months ago. If you take HRT, you're going to get a blood clot. Well, it's not like that. And actually, if you take HRT through the skin, through a patch or a gel, it doesn't change your risk of blood clot at all. So I would personally give that with the advice from a hematologist. It would be safe to give that to a lady even who had had a blood clot in the past. It can slightly increase your risk if you take it through a tablet form. But this is all now getting a little bit too detailed. It's sort of really about, my main mission is menopause awareness. And on the 18th of October, we've got World Menopause Day, and we need to all really be chatting about it.
That's interesting. Oh, that's good.
So, yes, so we need to mark that. We need to talk about it. We need to be able to be open with our friends and our sisters and our nieces and our daughters. And you know, most women I talk to who are in their 50s now have no idea when their mum had her menopause or how she felt. What I hope is that those of you who are out there now in your 40s and 50s who've got daughters and nieces and friends with children, is that they will know. When they're grown up and they're talking about menopause, they'll say, oh yes, my mum used to tell me all about that. Like we tell our children and our nieces and nephews about other sorts of things.
Yeah, that's true.
Have education in school as well. We need the teenagers to know what it's like. You know, menopause is a serious health condition in that if I say it like that, you know, it's not a disease, but it affects a lot of people. It affects partners, it affects children, it affects relationships. I think we need a better understanding. So really that's an overview to let you know there's help out there. Not that you have to come to me, that you can talk to your GP. There are websites to look at that will really help you. The British Menopause Society, Menopause Matters, and the Women's Health Concern. They're all really good websites with proper information. And you can empower yourself before you go to your doctor. And if you need extra help and you want to...
They love that.
For some extra time. Yeah, they do.
They're like, oh God, you've been on Google Doctors.
And they go, we can talk about one thing on the list. But, you know, if you want some extra help and you want to pay for some extra time, I'm there. And you just need to look at my website, which is somersetmenopauseclinic.com. Okay.
Can I just, there's one more question. Yeah. Do you mind? No. I'm just about to turn 40. Other than diet and exercise, what are your top tips for what I can do in the lead up to becoming perimenopausal?
I think you've said it all. It's diet and exercise, isn't it? And de-stressing yourself. And we all are trying to do that, aren't we? We try to rest. We try to go on holiday. It's very difficult. And most women won't start this change until they're about 45. But 1 in 100 women will start by the time they're 40. So you can have an early menopause. And I'm glad you asked that question, because actually I want the message to get out there that for women who have an early menopause, particularly those who menopause in their 30s, it's not about the danger of HRT, it's about the danger of not taking HRT, because you need that estrogen for your heart. And
I'm well up for prolonging estrogen.
Yeah, definitely. And another thing I just thought of, I must tell you, because this is a question that's often asked. A lot of women come in to see me and they say, well, I don't want to take HRT because it's just going to happen anyway when I come off it. It's not, okay? So HRT does not delay your menopause. It masks the symptoms. So if you go on it for a couple of years, 3 or 4 years, whatever, and you're talking to your health professional, it might be me, and I say, well, why don't you come off now, Heather, and see how you are? And if your symptoms come crashing back, you are one of those ladies who's still got symptoms. Okay, and you're going to then talk about whether you want to stay on it or not. If you come off HRT after a couple of years and you've got no symptoms, then you've done it, and it all happened while you were on the HRT. Yeah. So that's a bit of a myth, really, around it. It's sort of it doesn't make it. It doesn't delay it. It masks it.
Okay. Well, that's interesting.
Okay.
We definitely need to talk about this, ladies. I had no one. I'm nearly 60 and would have loved to have talked to someone about it.
Good.
Definitely lots of help out there now. One more. How do you know when you come off HRT? I'm very reluctant to, having taken it for about 6 years.
So that goes back to what I had just said. Perhaps the lady's referring to there used to be an arbitrary limit for it. We used to say you must come off HRT by the time you're 60, or if you've been on it for 2 years. The NICE guidelines no longer say that, as long as you are being reviewed by your doctor so that we know you're on the right HRT. HRT is complicated. There's estrogen only and there's estrogen with progestogen.
Oh, there is different ones.
Yes.
I didn't realise that. Yeah.
And if you've had a hysterectomy, you only need estrogen. But if you've still got your womb, or you haven't, no, how can I phrase that? So if you've had a hysterectomy or you've got a Mirena contraceptive device in, you only need estrogen, you're safe. If you've still got your womb and you haven't got a Mirena in, you've got to have both. The progestogen protects the lining of the womb from becoming cancerous. So there's different types. Things change as you get older. You know, if I saw somebody who was 51 and I said, off you go, here's 5 years of HRT, you'll feel great. By the time I saw her in 5 years, she might have gained a lot of weight. She might have started smoking. She might not be exercising. Her risks would be different. As long as you're going back for your risk-benefit analysis and you and your health professional decide that the risks are outweighed by the benefits, you can stay on it. And I've got ladies on it in their 60s. I've got a lady who's on it in her 70s. You know, I know of a lady who's in her 80s who's just, you know, she said, I don't mind what happens. This is about me and my life, and I've got to be comfortable and I've got to live like this. So it's about an educated agreement between people. So that would be my answer to that.
Oh, this is so good.
Good.
Oh, thank you so much.
You're very welcome, and I wish you lots of luck. And I think looking at those websites will really help. There's also an excellent book. I didn't write it, and I'm not on commission, but it was written by my menopause tutor. Her name is Kathy Abernethy, and it's Kathy with a K, and it's called The One-Stop Guide to Menopause. You'll get it for about $9.99, I think, on Amazon. And honestly, you won't put it down. It normalizes what's happening. You know, some women sit down in front of me, and when I say, you know, what do you really want help with? Or I wouldn't put it like that, but you know what I mean? How can I help you? And some women say, just tell me that that something awful isn't happening to me. You know, that I'm not going mad, that I'm not. So get the book. It's good. Get it and pass it round. Leave it at work.
Yeah.
Read it.
Okay. Last bit. In the last 12 months, I was prescribed a different HRT due to the time that I'd been on it. It's been a lifesaver for me. I had such horrendous mood swings, really severe, very quickly went back to being a much more rational me. Oh, it sounds very helpful.
Good. She's on the right track. Excellent.
Yeah.
Good. Well, good luck with everything you're doing, Heather. And
thank you so much.
You know where I am. Please get in touch.
Absolutely. Okay. Yeah, we'll put the link and everything. I'll put it in the thread.
Lovely.
And just one more thing? Are you happy for me to post this out onto social media as well?
Yeah.
Or would you rather it stayed? Yeah. Okay.
Yeah. No, that's absolutely fine. If you could just put a disclaimer on it that things change. So